goal is to make treating your patients easier, more effective, and more efficient. We make a full line of irrigation products that are used to treat wounds, eyes, abscesses, noses, and ears. Today, I'm going to talk to you about the EyeCap. Eye irrigations are traumatic for both adult and pediatric patients. They're especially difficult for young children who are often unable to understand the procedure and unable to cooperate. The EyeCap was invented by a pediatric emergency room physician to help make it faster and easier to initiate treatment for both kids and adults. The EyeCap is a simple and portable eye irrigation device. It's non-invasive and does not require numbing drops to get started. It can be used as an alternative to other irrigation techniques, which can be difficult to tolerate. The EyeCap is great for washing out minor irritants and debris from minor injuries. It can also be used as a bridge to an irrigation lens for more serious injuries that require more prolonged irrigation. The smooth, rounded rim of the EyeCap is designed to fit the contour of the orbit of the eye. It's one size fits all. You only need to stock this one cap, since the single size will fit anyone from a newborn baby through an adult. Now, I'm going to show you the unique patented spray nozzle, which makes the EyeCap so special. See how the streams of saline are directed outward to the side of the cap? No matter how hard you squeeze the bottle, the streams hit the inside wall and trickle down. This design ensures that there won't be any direct impact on the eye. When an ocular injury occurs, you don't want to make things worse for your patient by blasting the delicate surface of their eye with a harsh stream. Remember, patients are already likely to be very anxious and in a lot of pain, causing their lids to be tightly clenched. If the patient recently had something such as bleach or perhaps a cleaning solution get into their eye, you really wouldn't want to irritate that already sensitive surface even further. What's convenient about the EyeCap is that it acts as both an eye wash for external decontamination, as well as a device for irrigation under the eyelids. See how I'm doing an external decontamination? Start by squeezing the bottle, lifting it off the face, and letting the fluid rinse away. You can repeat this step and rinse a couple of times as you get started. This external decontamination helps prevent irritants left on the skin from the initial injury from being washed back into the eye. Once I complete that external decontamination step, I'll place the EyeCap back over the eye, gently forming a seal. And the cap will fill with fluid. See how the fluid collects up underneath to create a swimming pool effect? Because the fluid is always aimed at the sidewalls, there's no impact pressure on the eye. It's like being underwater in a swimming pool. You can gently tug on the sides of the lids to separate them and get the first bit of fluid in between and under the lids. Once you get a small amount of fluid in, the patient often feels better, trusts you more, and becomes more cooperative. Now you can get them to open their eye on their own. The pool of fluid helps irrigate up underneath the eyelid, and each blink can help sweep more fluid under it to dilute the irritants and foreign bodies underneath the lids. This overflow port should always be oriented toward the side of the face. It allows for the pooling of the fluid and then a continuous flow and continuous dilution. This design overcomes the problems with other rig techniques that use an IV or respiratory tubing to drip fluid into the eyes. The drops or streams are irritating and trigger the blinking reflex, which is difficult to overcome. As a result, using these other techniques, much of the irrigation fluid flows around or over the eyelids and creates a mess without making it to the eye surface where it's needed for irrigation. The zero impact pooling design of the EyeCap helps overcome the blinking reflex. The volume of this dilution pool is significantly larger than any drops of fluid that may have become retained under the lids. The overflow port allows for continuous irrigation and therefore continuous dilution. We recommend using at least 1 bottle of fluid to each affected eye. Repeat as needed. We recommend always using the EyeCap first when irrigation is needed because it's fast, convenient, and effective. And after using the EyeCap, you may decide you don't need an irrigation lens. This hard plastic irrigation lens is inserted up under the eyelid. It is typically done by those properly skilled and trained on the insertion and monitoring and removal of the lens or lenses. For example, eye irrigation is within the National EMS scope of practice model guidelines for any basic emergency medical responder. But irrigation lenses are only within the specialized skill set of paramedics. Another benefit of using the EyeCap is that you typically don't need to use numbing drops to get the irrigation started. While numbing drops can be helpful to overcome the pain and the spasm of the eyelids, the drops also have the potential to mask the pain from the eye injury, including pain from a known or suspected foreign body. Keep these issues in mind anytime the use of ocular anesthetics is considered. Speaking of foreign bodies in the eye, the EyeCap can also be used if there's a known or suspected foreign body to attempt to float it out. Remember, the EyeCap can provide instant relief. It's simple, non-invasive, saves money, and is easy to tolerate. Use the EyeCap for treatment of minor injuries. Standardize your care by making the EyeCap a first step initiated at triage for all of your ocular splash injuries. Build it into your EMR order sets to make sure that your staff uses the EyeCap to stop the sizzle before more damage occurs. Thank you for taking the time to learn about the EyeCap. For additional information on it or our other products, including the SplashCap, Abscess Cap, Schnozzle, and EarCap, please visit our website at www.splashcap.com. Thank you again. Stay healthy and stay safe.